According to statistics released by the Administration on Aging, the elderly are expected to make up an increasingly larger percentage of the U.S. population in coming years than ever before. We may face many health challenges as we continue to age. Healthy aging is a hot topic for baby boomers everywhere. Whether you're concerned about weight gain, your sex drive, or chronic diseases, the key to healthy aging is a healthy lifestyle. Eating a variety of healthy foods, practicing portion control, and including physical activity in your daily routine can go a long way toward promoting healthy aging. Better yet, it's never too late to make healthier lifestyle choices. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. So how do we age in a more healthy way? Well, Dr. R.L. Cole from Florida Hospital is here to give us a few tips. Dr. Cole, we talk about healthy aging. Is that possible?
Absolutely.
I mean, aging is aging.
Aging is aging. We're all getting older, but we can absolutely age in a healthy way.
What are some of the things that we encounter, like decade by decade, that are normal? You know, because we get a little frustrated as the years go on that there are things that we used to do that we can't do anymore. How much of that is normal, and when should we start getting concerned?
The body systems do age, do change with time. We notice changes in the skin, right? It becomes more thin, less elastic. We can see the structures underneath, the blood vessels and tendons, more easily with the thinning of the skin. We know there are changes in bones. There are changes we don't see, like changes with our kidneys. Kidneys function less efficiently with time, and that's just normal.
Is there anything that you can do about that?
No, there's just normal changes in the way the cells function that we can't change, but we can optimize our overall health.
You mentioned kidneys. Are there other systems in our bodies that change the most as we age? You mentioned the skin, kidneys. What else should we look out for?
I think it's worth paying attention to the immune system and the fact that the immune system changes with time and that it's less responsive to diseases. You may be familiar with shingles, which is a reemergence of the chickenpox virus that lives in your body. That usually happens in older adults because the immune system has become less able to keep that under control.
Well, are there some systems that age the least?
Sure. The gut, the GI tract, changes fairly little over time with the normal.
Engine.
Yeah.
It's amazing. That's you know, we focus a lot on what's happening on the outside when we should be concerned about what's going on
the inside.
On the inside.
Yes.
So for people who have really burn the candle at both ends and now in their 50s and beyond and are going, oops, what advice would you give them?
Well, stop burning the candle at both ends.
Okay.
Stop doing those things that we know are harmful to our bodies, like smoking cigarettes, drinking alcohol excessively, eating very poorly, eating primarily processed foods or high salt and fat. Change those habits and eat well. Eat fruits and vegetables, get exercise, move your body, lose weight if you're overweight.
Is there a point at which damage that was done when you were younger can't be undone, or is there, you know, a silver lining to that dark cloud?
You can always make improvements. You can't always reverse everything that's been done, but you can always make some improvement.
So let's talk about memory loss.
Okay.
You know, that probably is one of the most frightening things that anybody who's watching the clock tick
Sure.
can face.
Sure.
No one wants to forget where he or she put things or who people are. How much is normal when we talk about memory loss?
We all forget things on occasion, and that does happen more frequently as we get older, but it shouldn't impact your ability to function.
When should you get worried?
Anytime you're really worried, I think it's worth bringing up with your doctor, because your doctor can do some tests to help define whether there's a problem or not. It's hard to draw a line in the sand, because some people with higher intelligence, higher education will compensate more, and it will not be as obvious that there's a problem until it's more severe. So if you're really feeling like there's a change from your prior level of functioning, bring it up. There's no harm in asking your doctor about it.
Do you find that people are afraid to even broach the subject with you?
Absolutely. Absolutely. It's a terribly frightening thing to consider that you may be losing your memory.
But it's probably more frightening to not do anything about it.
Your doctor can help.
Okay. We also see that certain things are suggested more for people who are aging. Flu shots, for example. Is that a function of the immune system not
being able to respond as quickly as it did in younger years? We know that the elderly are more vulnerable to severe infections.
Now, you told me earlier that the average age of your patient is around 80. Are there some things that you notice all the time, or with some degree of regularity with the patients that you treat, and you can kind of tell when the onset of those things started?
Well, you brought up memory loss. Unfortunately, it's very common. Dementia is a medical term for diseases that cause memory loss, and Alzheimer's being the most common one. And about 50% of my patients have that.
For those of us who have parents and grandparents who have been diagnosed with dementia or Alzheimer's, do you find that there's a worry that maybe this is going to be me in a few years?
Of course.
And what advice do you give?
First of all, it's such a common illness that unless you have many, many family members who had it at a young age, you're probably not significantly more likely than anyone else to get it. But I do think that there's a sensitivity to, oh dear, I left my keys and then forgot where they were, and therefore maybe I'm getting Alzheimer's. So check yourself, be aware that we all do that from time to time, and that's okay. But feel free to bring up your concerns with your doctor.
Let's talk about bones and joints, because that's one of the things you mentioned. What can we do to protect ourselves? You hear a lot of stories about people getting older and falling and, breaking bones.
Yes. Hip fractures.
Tips on how to keep that part of our body healthy.
The biggest factor, especially for us ladies, is getting enough calcium and staying active, weight-bearing exercise.
Which would seem to fly in the face of that.
I agree. But the truth is that bearing weight, meaning putting a stress on your bone, cues your body to rebuild that bone and keep it healthy.
Are we talking about running?
No, not necessarily. Walking is bearing your own weight, right?
Okay.
Doing some minor weight lifting.
Which,
just
like 1 or 2
soup
pound
cans,
weights?
1 or 2 pound
Soup
weights.
cans?
Soup cans is fine. Do it while you're watching television. Just use those muscles, put some stress on your bones to cue your body to rebuild.
So if you're trying to prevent an injury by not doing something, you're actually doing something to help the injury along.
Absolutely.
If you had 1 or 2 tips for someone other than get the soup cans and start doing curls, what else would you say?
Stay involved, stay active, challenge your body, but challenge your brain as well. Learn something new. Get involved in a dance class or learn a new game.
The idea is to keep everything active, because the more active it is, the
healthier.
longer you'll be able to use it and the healthier. And would you say that's the definition of preventative medicine?
Absolutely.
Okay. So we want to help you help us. And staying active, moving, challenging your mind, we can all do that.
We can do that.
Okay, Dr. Cole, thank you.
My pleasure.
More right after this. Don't go away.